Welcome to Goal Getter, the AAP Physiotherapy podcast. My name is Jen Panteluk, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. It's my pleasure to welcome Alberta Association of Physiotherapy's branch president, Dr. Geoff Schneider, today. Geoff, welcome to the podcast.
Well, thanks, Jen. I am very excited to be here.
So today we're going to dive into the world of physiotherapy, try to dispel some of those myths that we and you and I commonly hear all of the time, and some of the misperceptions around the profession. Many people have heard about physiotherapy, and one of the things that I've found since taking on this role is just how little people really do seem to know about our profession. Could you maybe distill it down in a sentence or two? Like, how would you define physiotherapy?
Well, thanks, Jen. That's a great question. Of course, in a sentence or two to cover the vastest, it's challenging, but I'll do my best here. Basically, physios are educated healthcare professionals that have, the expertise to assess a patient that walks in the door, but from multiple perspectives. So one might think we would do a very sound, detailed physical examination, come up with a diagnosis and a treatment plan. But a lot more goes into it than that. The patient in front of us is a person. They have a family, they have a work life, they have, desires, and they're active and all these goals to achieve. So we have to really examine the person from a physical, but also from a, sort of psychosocial perspective to see how their problems impacting their entire life. And then we work with them, with their families, with other healthcare professionals collaboratively to come up with a treatment plan that helps them get back to the goals that from a common ground that we feel and that the patient feels that they want to achieve.
Right. It's a lot around the goal setting and making sure that all factors are considered, I think, is one of the pieces I've noticed as well going into physiotherapy for my own personal health journey. One of the things that I hear a lot about when I'm out chatting to people in the general public or having conversations with various levels of government is you only go to physiotherapy if you're in pain. Can you maybe unpack that a little bit about why is that a bit of a misconception?
For sure, it's a great question. I think it's probably one of the number one drivers. None of us like to be in pain, that's for sure. So although it's common to come when someone has a pain-related condition, you look at multiple aspects of their life, and if they're if they're sitting in their workplace because their job is largely around working at a computer, but yet they feel they can't do that. That might be the fact that they have pain, or the fact that they're stiff, or just uncomfortable. There are lots of reasons why they wouldn't be able to accomplish that task, and it's not always the first 5 minutes that they're at that station. It could be at the end of an 8 or 10 hour workday. And so a lot of people can, if they don't have that knowledge base to say, oh, well, why can't I do that? A physiotherapist is a great person to ask that question and help you achieve that goal.
And so one thing that I think both you and I often hear when it comes to the profession of physiotherapy is physiotherapy is just exercise. And I know it would take probably more than one podcast episode to really talk about all the things that physiotherapy is. But can you maybe touch on and share some of the different treatment techniques someone might experience when they visit a physiotherapist?
That's a great question, Jen. And I think, we've all heard in one way, shape, or form, exercise is medicine. And that's true. Exercise is beneficial for more than just the physical part of our life. It's beneficial for the mental aspects of our life and so forth. But exercise is one way to get you there, but it's not just go and do what you want. It's that expert assessment that's going to detail any impairments, whether it be reduced range of motion, strength, endurance, whether it be looking at the sort of the functional task as a whole. And so exercise is one way to get there, but there's manual therapy. So manual therapy would be when a physiotherapist basically lays their hands on you. That might be to mobilize a stiff joint. That might be to provide some sort of soft tissue pain management technique to reduce pain intensity. And other times you can do that with the use of modalities. So sometimes, physiotherapists will use acupuncture needles if they're performing more of a traditional acupuncture technique, or use the same needle if they're doing a dry needling technique such as IMS or intramuscular stimulation for just to spell that out. So all of the techniques might have a common goal of reducing pain, which then through exercise and education and sort of modifying lifestyle, we can look at getting back to the mobility that they need, to the strength that they need to accomplish that weekend warrior task of going for that 2 hour hike, or like yourself, competing in that triathlon, right? All the way to something maybe not less important, but maybe more simple, which might be making sure that you can, care for your family members or care for a loved one, or be able to, build the fence in the backyard on that beautiful summer day here in Alberta. So at the end of the day, all of the techniques, manual therapy, education, exercise, all work together to help someone get to that endpoint.
I know when I go, one of the biggest things I appreciate with any of the appointments I've had is the education piece. I don't know how many times I've been in an appointment and, different diagrams are pulled out, or we're really digging into the connections and then, what's actually causing that issue that you're going to see the physiotherapist for. So I think the education piece is so important. And one of the things I really find is physiotherapists take the time with their patients. There's sometimes that you kind of feel like you're rushed in and you're rushed out, but when you go to a physiotherapy appointment, time is taken with each of those patients. And do you want to maybe chat a little bit more about the importance of that when someone goes in to see a physiotherapist?
That's a great point, Jen. I think as physiotherapists, we have prioritized time in our appointments, and we should prioritize time in our appointments, and the public should be expecting to have time in the appointments with us, because you're right, the getting to build that therapeutic relationship. So as you know, you've been to many clinicians in the past. Trust is an important factor, and it takes time to build trust. It takes time to build that therapeutic relationship, and especially when you're looking at goal setting. It's not my goals for the patient, it's the patient's goals working with me or working with a physio to come up with a common understanding of where they want to go, and that takes time. We know that in an appointment it could be 30 minutes to an hour. They're one-on-one with your clinician, and in that time you can accomplish a lot of things. But there are 23 hours a day outside of the clinic, and at that point in time, that's where education is key, because you want to empower the patient to be able to say, "Hey, listen, there are a lot of things that you can do to help you get to the point that you want to be at, to get you feeling better," and it really taking that time to outline and plan the patient's plan outside of the clinic is very, very important, and that takes time. You can't do that in a 5 minute meet and greet.
Yeah, exactly. So, diving back into some other common myths that we often hear about physiotherapy, uh, one thing I hear very often is physiotherapy is only for people recovering from injuries. Can you maybe talk a little bit more about other ways physiotherapy might support health and wellness outside of just I'm injured and now I need to find someone to help recover?
Oh, you betcha. And there's a topic for a lengthy conversation, but we'll try to be brief. You can look at across the continuum of prevention strategies. For example, we've got primary prevention, secondary, tertiary prevention. So if a patient already has a certain problem or a disability, now we're working at more of a secondary and tertiary prevention strategies. If you look at we have expertise right here in Alberta, worldwide expertise on injury prevention in a multitude of sports. For example, whether it be soccer or other dynamic sports like that, there are injury prevention strategies and research that shows a neuromuscular training program is very, very effective in reducing ankle and knee injuries, let's say, for example, in youth soccer players. And so you have quite a prevalent problem, but then you've got physiotherapists with the expertise to prevent that problem from happening in the first place. You've got physiotherapists working in the workplace, looking at ergonomics, trying to prevent neck and back pain and repetitive strain injuries to the shoulder and wrist and elbow and so forth. You've got physiotherapists working in diabetes programs, working in the pediatric populations, looking at our vast, wonderful indigenous population in Alberta. And every population and culture sometimes has conditions that are more prevalent to that population and culture. And physiotherapists are right in the middle of those models, looking at all aspects of various conditions from diabetes, obesity onward from a prevention perspective. So I think that that's a
Right.
huge part, that physiotherapy is probably somewhat underutilized in our healthcare system. And when you're looking at refocusing healthcare, like we've been involved now for the past 6 to 12 months or so, primary prevention and using a physiotherapist's expertise is right up that alley. And I think it fits with refocusing healthcare. I think it's a long term solution, so it's not going to be something you can just implement tomorrow. But I think that the education expertise of a physio, especially their ability to collaborate, we talk about not working in silos, and start
Mhm.
to collaborate with other healthcare professionals and industries, allied health, primary care and specialist care and so forth. The physiotherapist has that education, that understanding to be able to, on the patient's behalf, right, communicate with the various other aspects of healthcare for the common goal to what patients are trying to achieve.
Yeah, I firm believer it's how do you ensure people are having access to the right care at the right time by the right professional? And I think that's, to your point, it's a great point about the importance of who's part of that healthcare journey and who do you have on your team to help that path forward. I also love the idea of prevention. That's the primary reason I personally go to physiotherapy, is to prevent myself from ending up in the system and having to recover from an injury. So I think that's one that people should really lean into. It's how do you keep yourself moving as you go through every stage of your life. Are there any other common misperceptions that you hear in your day-to-day work, Geoff?
You bet. So many a time we speak to patients, we meet them day one, and we'll ask them about, oh, what type of care have you had prior to coming to see me today? And a patient may say, well, I went to a certain facility and I was just laid on a hot pack and had a little machine that tingles, to make me feel better for the 15 minutes, and then I got up and that was the only care that I had. Unfortunately, that situation can spill over into people's perceptions, and it might be the perception of the family physician that wants to refer the patient for physio. It might be a family member that had that experience in the past, and now that they've told all their family members that this is what rehab is all about. But absolutely, that's not what rehab is all about. That might be one aspect of a patient's care from a pain management perspective, if you're looking at that piece of the puzzle in terms of helping them with their whole plan. But physio is much more than that, right? As we mentioned, right, you've got the manual therapy, the hands-on approaches for those that require that to help them with their pain, and ultimately help them get moving more. You've got education, which education itself, as you mentioned, Jen, is such an important to factor to really build that internal locus of control for patients, so that they feel they've got control of the situation. They're focusing what can they do for themselves in that active approach. We've got tailored exercise, so it's not a one size fits all. If you evaluate a patient, you see what impairments are leading to their disabilities, which are not allowing them to accomplish as they want to accomplish, and you tackle that one step at a time with the right exercise program, and engaging them to be able to do that on their own when they're not in the office. So all of that is really that what we call multifaceted physiotherapy or multimodal physiotherapy, and that's what a patient should expect when they go to see a physiotherapist. That's what a referring source should expect when they ask their patient to go see a physiotherapist.
So, for those that haven't maybe stepped into a physiotherapy clinic before or had that experience, let's talk a little bit about what you might expect, because I think it's a very different experience when you enter some of the other healthcare professions clinics, and we all have that experience of being rushed in and rushed out, or um spending very little time. And so can we talk a little bit about, when you go in for that first appointment with a physiotherapist you've never met before, what might you expect for that first visit?
So if I look at it from both aspects, I know it's easy for me being a clinician and an academic, but a clinician part of the week in private practice. But let's talk about our wonderful public practice colleagues. So whether you're in hospital or you're in an inpatient setting, or whether you're in an outpatient setting in a private clinic, you can expect somewhat similar greetings from a physiotherapist. So, of course, most physios are quite friendly and they're going to have a chat about all aspects of your life, not just what brings you in today type of thing. Getting to know you as a person, getting to know your family members, what makes you tick, what drives you day to day. Get into that psyche a little bit, and sort of the emotions of, what really drives this person to be who they are and where they want to go. And I think physiotherapists take the time for that. So that's one thing that you should really be getting visit one, whether you're in hospital, recovering from a surgical procedure, or whether you are going to a private clinic because you've suffered a fall or an accident or a sporting injury or a work-related injury, is that a physio is gonna ask you detailed questions, and those detailed questions are really what start to formulate the diagnosis. And so most experts would agree that if you ask the right questions in your mind, the clinician's already going to have a good understanding of what seems to be going on without even laying any hands on a physical exam. What we do from that detailed question is we start to formulate a working diagnosis, so we call it differential diagnosis. What are the reasons why this person has the pain that they do? And then a detailed clinical examination will either confirm that or negate that, based on using all of what the evidence or the research shows to be the best test to apply to diagnose a certain condition, or to tell you that that condition does not exist. And from that assessment, once we've with the help of the patient and diagnostic imaging and their detailed history, some of the notes maybe from their family doc or other specialists, we come up with a working diagnosis or clinical impression. And then that's how we would build our treatment plan or intervention, is around the diagnosis. And so you're going to sort of have a structured interview, if you will, at the start, asking some very important questions. Some might be very new to a patient, asking them if we're concerned about spinal cord compression, and we're asking them about their bowel and bladder use in terms of retention or lack of control. There's a reason behind that. And so some questions might seem a little bit awkward to some people, but the physiotherapist should explain, why am I asking you that question? And all that information will inform what type of clinical examination that we would perform, a detailed clinical examination involving examination of the nervous system, looking at joint mobility, looking at muscle function, recruitment strategies, looking at strength and endurance, or whatever might be lacking in that particular individual, and then coming up with a diagnosis of which we would relay to the patient and explain what seems to be going on. And from that, most importantly, is what type of treatment would help to remedy that diagnosis, and how long it might take to get better. What does the future hold? What does that look like? And I think if I've seen patients now for 26 years, the most important thing people often want to know is, what's going on? What do I have wrong with me, and what can we do to get it better? That's what people want to know. That's a pretty fair question to really expect that that's the answer that you should get out of that very first meeting with your physio, whether that be in an inpatient setting with our publicly driven physiotherapist, or whether that be more in a private setting or an outpatient clinic.
One of the things I really appreciate about going and like post visit with a physiotherapist is there's an action plan moving forward. And I think you alluded to that a little bit earlier about the importance of setting goals. So what is it that this patient who walks in or who's being seen in any setting, what are they hoping to achieve, and really working towards, okay, what's that pathway to get there, which I think is really important. We talked about the fact that you don't need to be injured to see a physiotherapist, and it's not just for athletes and those who are, weekend warriors or out playing at a competitive level of a sport. Why should a physiotherapist be part of your personal health care team, even if you aren't injured? What would you say to someone, like, why they should consider having a physiotherapist as part of their team?
When you look at a person as a whole, and you look at the multi systems, whether you are competing in a triathlon or whether you're cutting the grass in the backyard, you've got multiple systems at play. You've got your neurological system, you've got your cardiorespiratory system, you've got your musculoskeletal system that's going to help you get from point A to B. And what a better way to maximize the function of all those systems by working with a clinician that's trained in all of those areas. Right? When you look at a physiotherapist undergraduate education, you're training in pediatrics, gerontology, orthopedics, neurology, cardiorespiratory health. And not only that, but you're trained to work with other healthcare professionals. We go back to, healthcare is not about a siloed system. It's about the patient's needs in the center and all of the healthcare professionals that can help them, achieve their optimal sort of quality of life are around the outside working with them in collaboration. And we're taught right from the get-go is, communicate well with primary care home and their family doctor. Communicate with the various medical specialists that the patient may have to see, understand that lingo and that language and how those diagnoses affect the type of care that we would deliver as a rehab professional. And so, when you factor all of that in together, and the fact that physiotherapists really love to build up that relationship with patients to be able to get them from one end of the spectrum to the other, to achieve that common goal together. It's I can't think of any other health professional that really would do that on a day-to-day basis. And I think at the end of the day, sometimes you mentioned that the patient's goals. Sometimes people come in with goals that are very realistic, and you're more than happy to work with them to get to that point. Other times, and these are the harder conversations that we have to have, but we're built to have those hard conversations sometimes, is that, okay, maybe that goal was a little overzealous. When you've got that grade 3 sprain and you want to go back to, playing soccer next week, well, maybe that's a bit overzealous. So again, we've got to, not undermine the patient's goals or what they think is important, but to work with them to achieve that realistic outlook moving forward.
Yeah, and I love that you say that in terms of like working with them with their goals versus trying to prescribe exactly what they need to be doing, and understanding that, to your point earlier, there's a lot of factors that contribute to one's health journey and to where they're at and where they're going. You had mentioned earlier, physiotherapy in the workplace or just some of those basic everyday activities. How can physiotherapy help with things like posture or stress relief? Um, or to your point, like the ergonomic conversation, you're sitting at a desk all day, maybe really limited mobility or overuse on certain parts of your body. How does physiotherapy help to alleviate some of those challenges that may occur?
I think, again, it all starts with that detailed first assessment. Day one, or whether that assessment spills over into 2 days, for example, if it's quite a detailed examination. And from that assessment, you need to look at all the factors. So you can look at all their physical factors and what seems to be going on, to create their pain. But then you look at all the environmental factors to say, well, what is also driving that? So you mentioned ergonomics, and that's a great point. So you're looking at the monitor height, the monitor distance from how they're sitting, the type of chair that they're using, the keyboard, the mouse, and all the positioning of how to optimize that situation to fit that individual's body mechanics in terms of preventing the issue in the first place, or now that they have the problem, preventing it from reoccurring or flaring up, right? And we all see that from time to time, or many a time neck and back pain, for example. If you look at the research, it's very episodic throughout someone's lifetime. And how do physiotherapists jump in there and work with the patient to minimize those episodes? So a lot of that is going to be that very detailed examination of environmental factors, social factors, sort of the physical and psychological factors that are affecting the patient on that sort of injury time period, and try to modify those and optimize those so that something gets better and the problem doesn't return.
I remember the one visit I had with a physiotherapist, and they said, my job is to not see you again, when I was injured and we were trying to work through that to recovery. So we've touched a little bit on, some of the common reasons why someone might go to see a physiotherapist. But one of the things I find fascinating about this profession is just how vast it is and how many different areas that physiotherapy operates within. Could you maybe touch on some of the lesser known areas where physiotherapy might be found, or different patient populations that a physiotherapist might work with outside of like sports and rehab, which is I think the two that come top of mind to most people when they think about the profession?
I'll definitely start with a topic that's near and dear to all of us. We just talked about that this weekend at our strategic planning meeting. Is you look at physiotherapists in acute care, like the emergency department, and that's an emerging role that has been piloted through different time periods, but seems to really coming to fruition where you're seeing physiotherapists apply their expertise in the acute care setting, like the emerge, which we know has long wait times. Our wonderful emerge clinicians, physicians, nurses, administration, health, various allied healthcare professionals, they are taxed. They are worked very, very hard, but they're dealing with a lot of volume, and they're dealing with a lot of people that are waiting for their expertise. And so, what a better place for physiotherapists to come in, especially looking at orthopedic injuries, like low back pain. You have a wonderful skill set to manage low back pain, help with the triaging and the diagnosis, and then to sit there and have the time to develop their care plan when they're discharged from the hospital. And that I think is really a wonderful use of a physiotherapist in that setting. And then you can offload other maybe more life-threatening injuries can then be seen by the right healthcare professional at the right time. And you hear that statement all of the time, and I think it can be applied very effectively in an acute care setting. You're looking at reducing length of stay, inappropriate admissions to the hospital, possibly reduce the use of diagnostic imaging, limit the use of long-term pain medication. And so you've got all of that can be achieved with a very good visit with a physiotherapist in the emerge for, let's say, again, that case of low back pain. You can move from the adult spectrum of physio in the emerge to the pediatric spectrum of physio in the emerge, or physio working amongst various healthcare teams, such as chronic pain teams. I mean, we never like to hear that that children and youth can have chronic pain, but it's quite prevalent. And you've got physios working amongst chronic pain teams. You've got physios working amongst rheumatology teams in various roles. And again, those are probably less known. You've got physios working in the ICU, looking at various cardiopulmonary rehab and positioning for proper ventilation perfusion, for example. So at the end of the day, you've got all of these healthcare professionals, physios working amongst all these teams in a hospital setting, outside of a hospital setting, and it's probably a lot less known. We talk about the restructuring and refocusing of healthcare in Alberta. You've got physiotherapists that can fit into the acute care arm, as we discussed, of physios in the emerge. You've got physios fitting into more of the long-term care part of health in retirement homes, in long-term care facilities, in home care, really helping patients with their independence and getting them moving and keeping them moving. You've got physios working amongst chronic pain teams. You've got mental health stressors that are in life, and you've got physios working amongst the other healthcare professionals to help with those issues. And then, of course, primary care. You've got physiotherapists that are well versed to see people right off the street without necessarily referral, because we are primary care healthcare practitioners that can get people seen sooner and getting them on the right pathway sooner to recovery. Yet at the same time, working very closely with their primary care home and their family doc to be able to provide that early appropriate care.
So physiotherapists have very vast knowledge and a wide area of expertise, but sometimes other healthcare practitioners need to be pulled into the conversation. How do you know when it's time to refer a patient on to another healthcare professional?
If you look at, you've got some physiotherapists that work already amongst a multidisciplinary team. You walk into the office and you've got sport medicine docs, you've got nurse practitioners, you've got massage therapists, kinesiologists, you've got various medical specialists from physiatry to orthopedic surgery or whatever it might be, all working amongst each other. And that's the easy example, right? Because you can have hallway conversations and say, you know what, this person's not getting better like I thought they would. What do you think's going on? Do you think that you're the appropriate professional to see them? And so so at the end of the day, there are clinics that are set up like that, which is wonderful.
Mhm.
There are clinics that are a little bit more of, let's say, one discipline, let's say, a physio in the clinic, but that physio is well aware that if the patient has a certain diagnosis that is either not amendable to physiotherapy alone, that could be right from day one. They're already integrating other healthcare professionals to help them move along the continuum, right? To get the right management early. If on the flip side, there's a certain diagnosis that the physio makes day one, and then they're 2 or 3 treatments in, reassessing at every visit to see if they're achieving the response or the outcome that we thought that they would achieve. From day one, you start
Mhm.
to prognosticate and say, okay, well, it should take 3 or 4 visits and we should see this improvement in range of motion or this amount of reduction in pain or, starting to return to work on a part-time basis. And if those goals aren't achieved when you reassess, then you've got to start to rethink, okay, well, why is that happening? And if it's happening because they have other underlying medical conditions or they have something that's not amendable to just rehab alone, but rehab might be a piece of it, then that's when we're starting to reach out to their family doc and say, hey, what do you think about this? Should they
Right.
see, a neurologist? Should they, have some other diagnostic imaging or get the family doc's expertise on a certain type of medication that maybe they could help prescribe to help, with the pain and so forth. So basically, when change is not happening or when certain flags pop up in the assessment findings that we say, oh, this is not just a physiotherapy alone issue, automatically we're getting on the phone, we're writing letters, we're contacting other healthcare professionals to bring them in as part of the team.
I think that's great to recognize that everyone has their own areas of expertise, and it's how do you bring all of those great minds around the table to help with that healthcare journey moving forward. What is the message that you would really like to share with listeners about physiotherapy and its role in healthcare? We've touched on a lot, but if there's one key takeaway that you could leave our audience with today, what would that be around the profession?
I would suggest that physiotherapists are well trained in multiple aspects of healthcare. They take the time to provide a detailed assessment, to work very closely with patients and their families and other healthcare professionals. They're all about collaboration for the betterment of the patient. And in keeping all those factors in mind, are really ideally set to help someone achieve the goals that they want to achieve because we're looking at it through a wide lens. It's not a narrow focus of, oh, you have this
Mhm.
one problem, this is what we're going to work on. No, we're going to look at that from a wide lens. And I think that's why we're sort of an ideal primary health care provider for various, musculoskeletal related um, issues. Is if is a very well trained to be able to either um, assess and triage that situation or work amongst a team to help patients achieve what they want to achieve. I thought about one of your questions, Jen. You talked about, are there things that people need to know about
Right.
physios of what they do, what they can't do? Um, and I think one of the important factors, because we've had changes in legislation over, even though I look back at the last 10 or 15 years, at the start, numerous years ago, certain physiotherapists could order diagnostic imaging. And we could order certain types of diagnostic imaging from X-ray, ultrasound, and MRI. And again, thinking of more of an outpatient setting. So you go into a private practice, and if you have a condition where somebody says, "Oh, we should really get an X-ray to determine what might be going on there before we proceed with management,"
Mhm.
then there was a change, there was a shift, and so now certain physiotherapists can still order diagnostic imaging, but the publicly funded MRI isn't part of that repertoire of imaging that we can organize. So that we would
Right.
collaborate with primary care. And if we thought, because we know, again, we know that diagnostic imaging has a little bit of that, concern, if you will, that it's overutilized, right? And we've got
Right.
to be responsible healthcare providers. And I think a physiotherapist with their detailed examination ability is an ideal healthcare professional in the musculoskeletal realm to order diagnostic imaging at the right time, for the right condition, and not overuse something or utilize those results wisely to help inform management. And so I think that that's a good thing for the public to know. And again, not every physio can order diagnostic imaging, which is okay. Because again,
Mhm.
it's about that detailed assessment. It's about that collaboration with the patient and other medical professionals that's going to get them to the endpoint where they want to be anyway. But I think just that distinction, that certain physios can order X-ray, ultrasound, and MRI if, on a private sense, if the patient wants to pay privately, if they have the means, or
Right.
that's something that's in their on their wish list. But yet, if it's a publicly funded MRI, then we would have to go through a physician for that.
Right, and I think that's a really important piece too. I think a lot of people assume if they need some sort of imaging done, they need to go to a family doctor versus that there are other healthcare professionals able to refer them on for diagnostic imaging. And when you look at the landscape in Alberta with so many Albertans not having access to a family physician, I think it's so important that they understand where are their other access points. You don't need to wait for weeks on end or try to get into a walk-in clinic to be referred on. You can go and seek the help of a physiotherapist.
That's right, and that we talk about team-based care. And I know, Jen,
Mhm.
you and I, and our board, and
Yeah.
speaking with the Alberta Medical Association, you look at the research that exists out there. Team-based care is very important for positive patient outcomes. And part of that is the timeliness of care. Part of that is the expertise of the care that's given amongst the whole entire team.
Mhm.
And with team-based care, I don't think you have to be under the same bricks and mortar, right? I think as
Right.
long as you've got the knowledge and the ability to communicate professionally with others, you don't have to be under the same roof. But it's timeliness. So I think you touched on a great point. If an Albertan is seeing a physiotherapist in their practice, and the physiotherapist and the patient together believe that this might be a medical management situation where it might be pharmaceutical advice, or it might be an ongoing referral. What's the time is the physiotherapist picking up the phone that day or writing a letter that day and getting it sent right to the family physician, so the team can still function well, even not under
Mhm.
the same roof.
Right.
Right. I think that's an important part of restructuring healthcare in Alberta moving forward, which I know, and that this is on the topic of conversation of a lot of people, and it only makes
Yeah.
sense, right? We strengthen numbers. Getting no single person knows everything, as much as we jokingly like to think so. No single person knows everything. So
Yeah.
we really need to get in those that have that knowledge at the right time, and that's really what team-based care is all about.
Well, and I always think about I always go back to my personal example when our daughter got burnt and we were in one of the burn clinics. They have a great multidisciplinary team there with access to a lot of professionals, and we were sitting down with the occupational therapist, and she was about to tell us some things that she thought should be part of our treatment plan, and she said, "You know what? Just wait. I'm gonna bring the physiotherapist in, I'm gonna bring the doctor in, we're gonna have a coordinated conversation." 5 minutes, and we walked away with a great plan to help, make sure that range of motion wasn't limited, that there was, no scar tissue building up. And the occupational therapist walked us out and said, "I'm so glad I did that because I would have told you something slightly different." But when again, the minds are together and talking and coming up with a coordinated care plan for a patient, I think there's a lot of power in that versus in some situations you see, one healthcare professional giving you one piece of advice and then if there isn't that connection and coordination, you might receive slightly different advice from another healthcare professional that might conflict a little bit or what does that care look like and making sure you're not getting duplication or care that might counteract the other care that you're receiving.
And that's just a wonderful example, Jen, of that there should be a big sign in every healthcare facility: leave your ego at the door. right? It's not all
Yeah.
about I'm the smartest person in the room and I'm going to help you. And I'm the only one that can do that. It's like, no, we've got a whole load of people around us that have a world of expertise. And if it means that your daughter gets the best care and you have the best information as her mom leaving the clinic with all this education from all these multitude of people, you're happy, she's happy, she gets better
Exactly.
quicker and appropriately, in many cases, and there's less questions when you get home. You're like, oh,
Mhm.
what did that person say, or that person contradicted that person? How many patients have that example in their life where they say, well, I went to this person, they told me to do that. I went to this person, they told me to do this, rather than that nice cohesive unit
Yeah,
delivering the same message, but from different perspectives. Right. And that's really
exactly.
what healthcare needs to be. And every
Yeah.
Albertan really should demand that that's what healthcare needs to be.
Yeah, agreed. Hopefully. Hopefully we can get there in the future.
Well, I would say, I mean, one thing that, and I've got the good fortune of being in academia as well. And
Right, yeah.
so, one thing that probably drove almost every point that I said today is coming from research, clinical experience, collaboration with others, and really when you're in academia here in Alberta, we've got to put on a little bit of a pat on the back or put on a bit of a pedestal some of the researchers that we have, especially in the
Mhm.
physio world, in our major institutions in Edmonton and Calgary, that are international leaders in what they do. And these are some of the unsung heroes, right? That
Right.
in the world of concussion management, which I know we're going to have Dr. Geoff Schneider on the line, hopefully here with the podcast, right? A world leader in writing the scientific recommendations around on how to manage sport related concussion, amongst other world leaders. You've got Dr. Carolyn Emery, world leader in injury prevention. We had a huge
Mhm.
conversation on injury prevention, and she's here at the University of Calgary. You've got you know uh, others at the U of A. You've got Doug Grass and his tireless career around occupational medicine and risk factors for recovery and physios right in the middle of the rehab world for occupational medicine and work injuries, workplace injuries.
Mhm.
And you've got others that work more in multidisciplinary environments within research, whether it be through the Cumming School of Medicine at UC, where you've got other physiotherapists working in different departments that are driving research in other areas, right? Nephrology.
Mhm.
You've got a physiotherapist with epidemiologist working in the area of nephrology at UFC. So, at the end of the day, a shout out goes to all the researchers that help essentially drive what the clinician does at the bedside, right? You've got other clinicians that spend a lot of volunteer time. Well, shout out to our board
Yeah.
at the Alberta Association. That's a lot of volunteer time to really drive the profession forward in this new age of healthcare, right? Amongst leaders like yourself, Jen, and Carmen, and others at our association. You've got physiotherapists working in education, in terms of working with kids in schools,
Mhm.
uh, working alongside, OTs and speech language pathologists and so forth, helping kids flourish in the classroom, which ultimately enhances their learning, right? Shapes their life for decades to come. These are all the sort of the unsung heroes, that you see out there. You've got, physios working on various committees within Alberta Health Services, trying to innovate and look at what research works, let's say for managing low back pain or hip and knee osteoarthritis or shoulder pain. I won't, toot horns of individuals there, but you've got people on our board that are doing that exact same thing and taking research, applying it to the bedside, and driving healthcare capacity innovation forward. And that really shapes the future for our young clinicians that are coming through the U of A. That's really shaping their pathway for their future work as a physio.
Well, and I think you bring up a really great point. One of the great things and the things that I love about physiotherapy is it's really embedded in evidence and research, and there's so much backing all of the work that's being done. And maybe you can dive into a little bit like Geoff, you do some incredible work in this province talking about tuning horns, but maybe talk a little bit about, you know, your background in some of the areas that you've done research in, because I think you've been involved with some incredible projects. And that's some great things we'd love to highlight too.
Well, without clicheing it, I'll take the old hockey player in me and always promote those around me. Right? It's the strong teams that I've been involved with, which really keeps me pushing forward with what I do here. 26 years into practice, so I had the good fortune of post hockey playing career, going to McMaster University for physio, and that's where my lovely wife and I met and decided to come back to Alberta, where healthcare and physio was pushing forward, and there was a great collaborative environment with other professionals. And that got into private practice, of course, working with musculoskeletal health and injuries, and that kind of drove us. The research bug was always in us. I mean, McMaster is one of those universities that, from back in the day, was one of these universities that really promoted a certain type of evidence-based learning, which always gave you the research bug. So I got, like both Catherine and I had the research bug, and we decided, I'm going to go back to school, and let's go and do a Doctor of Science degree. And at that time, it was a degree in the U.S., and it was really between, developing that expert clinician and giving them a big taste of research. Well, that big taste of research ended up, helping us toward our PhD. So both Kath and I went back to UC and did our PhDs with really a focus of either Catherine more in injury epidemiology and mine was more clinical epidemiology, looking at neck pain. And that's where my research career first started, was really looking at, well, how do we properly assess someone's neck to come up with, a certain diagnosis, which would lead them to, maybe some specialist care. So I was doing some work in a really unique area around diagnostic injections for people with facet joint pain in their neck, one of the joints at the back of our neck beneath our muscles.
Mm-hmm.
But that was something that I knew a physiotherapist had the expertise in doing. So how do we put a physio in that role to assess someone to know that are they appropriate to go for an invasive procedure such as the facet joint injection? And then that, I ended up collaborating with Ashley Smith and other great PhD physios, Carolyn Emery, and others, and has really been brought into the world of concussion now with Catherine's work. And looking at Carolyn's work, working with students with, hip femoral acetabular impingement. So my research career has kind of gone in multiple directions, but still in the world of musculoskeletal health. And then I was sort of blessed with being one of the tri-leads with a spine surgeon, Ken Thomas, and a chiropractor, Gord McMorland, and putting our three, professional hats into the ring amongst a vast committee of professionals to look at how do we manage low back pain better in Alberta. And we dove into that project. And unfortunately, things came to a little bit of a halt with the ceasing of the strategic clinical networks. But I think that the heart of that conversation is still going to keep going, in terms of research around how do you get someone in to see the right person at the right time and get them on that right pathway, and which is really the work of the SCNs in Alberta and what their mandate was. And I think that goal or that energy isn't lost just because the title is lost. A lot of people want to keep working toward the betterment. So, that mixing in with being a private practice owner, part owner in Alberta, and really driving research to the bedside and saying, oh, how can we provide the best care for patients that the research supports, that is innovative, that meets the patient's needs, gets them back up on their feet and moving. And so that full circle of ideation, I think, from research to bedside has, and then committee work, which helps get the knowledge translation and the capacity increased. That's what drives me to get out of bed every day and give 100%.
And you teach on top of that, right?
I do, yeah. Dr. Jeff Bostic, as you know, on our board, he's the main prof at one of the courses at U of A for the physio students, for the final year students. That a really nice course on looking at basic managing spine pain and TMJ. issues. And so I run the Calgary cohort. And so U of A's physio school has a really nice link to Camrose. They've got a satellite site in Camrose, Calgary, and of course their main stay at U of A at Edmonton.
Mhm.
And between the three sites, we are trying to help shape the next generation of physios. And that's one of the most fun parts of my day, actually, is working with young, smart people that are just full of energy and ready to tackle the profession when they get out. So that's actually a big joy in my day.
Yeah, working with students is always fantastic. I enjoy that part as well. One of the things I was thinking a little bit about as you're like on the student, uh, the education that a physiotherapist goes through is quite intense.
For sure. Yeah, the education of a physio is, yeah, as you said, Jay, quite extensive. So a physio student would have completed their undergraduate degree, and some might be in kinesiology, and some might be in science, some might be unrelated. In my physio class, I had physicians from Europe, I had engineers, I had psychologists, but yet they had obviously good marks, and they got into the program, which is quite competitive. It's a lot of applicants for not many spots,
Mhm.
like other healthcare professions, medicine and nursing and OT, and very similar, right? Very competitive to get into. But once you get in, it's a step on the gas. So there's not a lot of time off, and the program is continuous for probably in the ballpark of around 28, 9 months or so, with very little time off, and you really go from a education unit that might be 10 weeks long, some of the early introduction to orthopedics or cardiorespiratory or neurology, and then you would move into a clinical rotation, which might be 6 to 8 weeks long, and then you would go back into another education block, and then back to a clinical rotation. You'd rotate that through until you're finished. And then while you're in your residency, while you're finished, is you'll prepare for your national exam, which I know is changing somewhat, but it was always a lengthy written component, plus an OSCE component, which is simulated patients. And then all through schooling, you would do OSCEs usually each term with, again, simulated patients, working through cases. And then before you know it, it's all done, and you're into the practicing world, whether you're, as we mentioned, whether you're in hospital, working amongst the various floors and units of teams, or whether you're in long-term care or outpatient care, like in an orthopedic private practice, or whether you're in home care, where clinicians can go to people's homes and look at their home environment and help them, adapt appropriately and function as best they can independently on their own at home.
Do you think that we create enough space for healthcare practitioners to connect and interact and understand what's happening in all the different pockets around the province?
You know what? That's an excellent question and point, and the answer I'd say is no. I think healthcare practitioners are they're busy, right? And they've got
Yeah.
family lives outside of work, and you can come up with lots of reasons why we don't get together enough, but we really should. And it
Mhm.
would be great to get together in a multidisciplinary setting that might be somewhat structured with a few discussion points, but then let it go. Let it go
Right.
over a coffee, and just, much like we're just chatting here today, is just to say, okay, let's see where this conversation can take us. And I'll bet you people would learn more in 3 or 4 hours than they would reading 20 journal articles on a conversation like that. But real
Right.
bedside approaches, challenges, things that we could be or should be doing differently, and that mutual respect that you have when you talk to someone of a different profession, interested in learning what they do, and
Mhm.
then them querying what we do.
Yeah, maybe this is the next chapter of the association.
There you go. See, look at that. We'll have to go back and meet again. We just met last weekend for 6 hours. We're going to have to plan another one and add that to bullet point to the list.
I really appreciate your time today and helping to dispel some of the myths that are out there around physiotherapy and just really talking as a whole, the importance of physiotherapy being a part of this healthcare system and being a part of each patient's healthcare journey.
Thank you, Jen. No, it's an honor and always a pleasure to be on and talk everything physio. It's something that I can do in my sleep, but it's always a pleasure to talk to people that are passionate like yourself, and others about physio and what we can do to help patients, help the healthcare system function as effectively as it can.
Thanks for tuning in today. We had a great conversation with Geoff. If you're interested in learning more about physiotherapy or finding a physiotherapist near you, visit albertaphysio.com. See you next time.